Good morning, my name is Diana Palacio.
And I am Paulina Riola Núñez.
We're students of Universidad Autónoma de Durango. We're studying physiotherapy.
Next, we will be talking about injuries of nerves roots.
The function of the nerves is communicate organs from the brain to each organ or system and perceive external stimuli captured by the sense.
Much of this information is conduced by the spinal cord, which is protected by the spines that has intervertebral space that allows the exit of the nerve roots that branch and move to the last corner of the human body.
When the spine suffers from a deterioration, illness, or accidents that offers the interval orifice radiculopathy, or injury of nerve roots results. Injuries of the nerve root, this pathology rarely endangers life. It's a compression or impingement of the nerve root. Irritation of the nerves by the disc of the spine.
This disc can be displaced by trauma or can be deformed by degenerative effects causing impingement or irritation.
How can we know that we are facing a nerve root injury?
We can know that we are facing a nerve root injury when the pain is radiated from the spine. Classification. It can be cervical or lumbar. The cervical affects the upper limbs and is more common in men over 50. The lumbar affects the lower limbs and usually due to accidents.
Causes of injury of nerve roots. Among the most frequent causes are hernia disc, which may be due to genetic factors, lack of movement, or sedentary life, overweight, poor sitting posture, student movements, carrying heavy objects, practice sport of sedent movement, and the calcification of bones, car accidents, and
Other causes of injury of nerve root are weakening of vertebra, arthrosis, diabetes, tumors, and infections.
Symptoms and signs: pain and look of sensitivity, sensation of thinning or weakness, paresthesia and reflex deficits or morals, tingling sensation.
Symptoms usually get worse when the person tries to make efforts, such as bending over, trying to lift objects, among other things.
Diagnosis. Simple radiology can provide useful information confirming the existence of degenerate change in the cervical spine, ruling out fractures, congenital anomalies, or instability. Computed tomography can provide information.
Electrophysiological study. Its main utilities are the glutes and distal lesion, and confirm root damage, establish the number of affected roots, and define the activity and severity of the lesion. X-rays show the state of the spine and allow to see if the vertebra have suffered dining injury or are miscellaneous. Treatment. It will depend on the cause and severity of the symptoms. The objectives of the physiotherapeutic treatment are reduction or resolution of pain, increase the function, prevent recurrences.
During the first 24-48 can be treated with cold to reduce inflammation and muscle spasms. After 44 hours, the heat relaxes and blood circulation increases. We can use ultrasound, manual therapy, postural reeducation, relaxation of muscle spasms, stretching and exercise to straighten the affected area. Repose. Avoid activities that demand effort in the spine, lifting heavy objects, bending or straightening.
In some cases, it is recommended to use a collar that immobilizes the region. Active mobilization exercise. Transcutaneous electrical nerves stimulation. Stimulated your nerves decrease pain. Risks if treatment is not received. The symptoms or pain may worsen. The injured nerves could lead to problems when walking or moving. And even badly used rests could worsen the symptoms.
To finish, we will name some care to be taken into account for people with injuries of nerve root. It is important keep active, go for a walk, avoid being in bed for long periods of time, do not make student movements.
Use of cold or hot pack. This will be done with the goal of decreasing an inflammation with the care indicated by the health professional.
Avoid lifting heavy objects, since your condition could get worse. Maintain a healthy weight, since excess weight could twist your back.